what are some common mental disorders?
Brain
You're,
disorders.
you can go on and on with this list, but
I know. I think let's divide it into like to quickly make people understand. I think anxiety, depression would go on in all areas and all genders and all age group that we can talk about. In children, we are seeing a lot of ADHD, which is attention deficiency hyperactivity disorder. I'll quickly go through it, which causes inattention, hyperactivity, and again, impulse control. That there is a developmental mismatch or the age maturity or social maturity mismatch. We are seeing a lot of personality disorders. I'm sure that they have been existing, but the awareness have become much more higher. Borderline personality disorders, narcissistic personality disorders. These are the two things that are coming up in my clinical practice a lot these days. And I know for a fact that borderline is one of the most difficult to diagnose as well. But I am seeing, I think around like 5% of my population is suffering with BPD and I take around 3 to 4 months to diagnose it itself, to be very honest, to be sure of my diagnosis. Anxiety and depression are always there. Illness anxiety disorder, previously known as hypochondriasis, where you're very particular of where your health concerns are at the level of anxiety, are something that have come up a lot in the last 2 years. And OCD is obviously on the rise. Again, I am not sure to claim whether they're on the rise or there is better mental health access or awareness that people are coming up to us and discussing these problems. But OCD, personality disorders, ADHD, anxiety and depression always present, but these are the most common, or at least the most seen in the recent times uh, in the clinical practice.
absolutely. I would just like to add, substance use, substance dependence disorders. There are so many chemicals that are available on the streets today. I mean, earlier people used to be worried about smoking and cannabis and so on. Now you go onto the street, you can get, I mean,
Anything.
I test for 23 different drugs in my clinic laboratory. So you can
Okay.
get opiates, which is heroin, morphine, fentanyl, oxycontin, codeine, the works. Then you have
Yeah.
ecstasy. You have, I mean, the list is endless. And of course,
Endless.
you have alcohol. One of the
Yes.
commonest problems that we expect to encounter, alcohol dependence or alcoholism as an independent primary entity, and also as a disorder which coexists with a lot of other disorders that you have mentioned.
Absolutely.
So the list is
Absolutely.
endless. I think we need to do another few such shows to justice to all of them. And
Yeah.
I think that would be an end to the questions for today. Would you like to sum up for us what mental disorders represent in today's day and age?
uh, Brain disorders
Brain
is
disorders.
something. I'm rewiring myself already. I think we have to see that when we talk about brain disorders, uh, the first thing that we have to do is we have to destigmatize ourselves or our patients as well who live with such conditions. We don't have to worry about the public or the social perception. It's very important to start, as I'm aware that this show has a lot of physicians and a lot of medical practitioners as viewers. I think it's very important to understand these disorders, to get these people the right kind of comprehensive health care over the interventions that they require. Um, Secondly, if one of us is also suffering, let's not do that in silence. Let's understand that brain disorders are nothing but an impairment to our everyday functionality, our potential to achieve, our capability to achieve our potential. And if there is a impairment in your thoughts, if you're in your behaviors, in your emotions, in your productivity, then forget about the label, forget about the diagnostic criteria, and seek help, seek support. Because sometimes it's not only about, वो कहते हैं ना, समझाने की जरूरत नहीं होती है अपने आप को या अपने पेशेंट को, बट कुछ चीजें सीखने की भी जरूरत होती है. the way that you taught me to rewire to call mental disorders brain disorders, there is rewiring can happen in multiple ways, and we can provide help, and there's a lot of accessibility and a lot of good care available now. So let's make use of it.